Well, lymphedema is arm swelling, and it can be caused during a breast cancer procedure where we take lymph nodes underneath the arm to stage the breast. And so what happens, the lymphatic drainage that drains the fluid out of the arm gets cut during the surgery inadvertently because we can't see it necessarily. So what I've done is develop a procedure called ARM, or axillary reverse mapping, where we put blue dye in the arm so that we can see where the arm is draining, and then we can avoid that. You can't avoid it 100% of the time, and so sometimes we have to take those lymph nodes. So we developed another procedure to put it back together, and we can get the lymphedema rate down to less than 1%. The best way is to prevent it, so have the arm procedure during surgery, so if you haven't had your surgery. But if you've already had your surgery, you want to avoid any kind of infection in that arm. If you see infection, you want to get some antibiotics right away. The worse the risk and the higher the risk of lymphedema. You can wear gloves when you're out gardening to prevent any kind of cuts or nicks. Washing dishes, wear gloves. And then simple things like keeping your blood pressure in control can help a lot. You can increase your risk of lymphedema by 50%. If you've already got lymphedema, we recommend seeing an occupational or physical therapist that is specialized in lymphedema treatment, because it's a specific type of massage that we use to get your arm unswollen. And then we wrap the arm, and then we fit you for a compression sleeve that will keep your arm at that same kind of pressure all the way up that you wear during the day when you're working and take off at night. Risk associated with lymphedema really have to do with whether it's going to be permanent or not. So the earlier you see your arm swelling, even if it's a minor amount, seek help early. Get into a program where you can start massage and wrapping and get a sleeve that fits there to keep your arm from swelling. Because if it becomes swollen for too long, you get a fibrosis and hardening of the skin. It's uncomfortable. Should see your doctor and see about a physical therapist just to learn how to massage your arm. It may help prevent lymphedema.
For more information about breast health at UTMB, visit utmbhealth.com/breasthealth.